Order, order. Question to Secretary of State for Health and Social Care. I call Secretary Matt Hancock to answer substantive question number 1 from Jason McCartney. Secretary.
Thank you very much, Mr. Speaker, and with your permission, I'll answer questions 1 to 9 together. I'm proud that the NHS began vaccinating patients against COVID-19 on the 8th of December at the start of the biggest immunisation programme in British history. I'm delighted to tell the House that over 2.3 million people in the UK have now received the first dose of their COVID-19 vaccine, and over the coming weeks and months, the rate of vaccination will increase as more doses become available and the vaccination programme continues to expand.
Let's head over to Combe Valley with Jason McCartney. Jason McCartney.
Thank you, Mr. Speaker. Thousands of elderly and vulnerable people have already been vaccinated across Kirklees, but some of my constituents are rightly worried that they may have to travel to other parts of the country to a large vaccination centre to get their jabs. Can the Secretary of State please confirm that all of my constituents will be able to get their jabs locally? And when will the new vaccination centre at Huddersfield's John Smith Stadium be opening?
Well, yes, everybody will be able to get a jab locally. We're committed to ensure that across England there'll be a local vaccination centre available within 10 miles of where everyone lives. For the vast majority of people, over 95% of people, this will be a fixed permanent site. For some of the most rural parts, more rural than my honourable friend's constituency, that some of these will be mobile units. But if people get called to a vaccination centre, a mass vaccination centre, and they feel it is too far for them to travel, then they will be able to get a vaccine locally by one of the local GP services. And specifically on the John Smith Stadium in Huddersfield, I'm really delighted that this is going to be opening in the next couple of weeks.
Thank you, Mr. Speaker. I very much welcome the great work by my colleagues in government in securing the vaccine supplies for all parts of the United Kingdom, and the amazing work of the NHS staff in ensuring that these vaccines are being delivered into people's arms as quickly as possible. But can the Minister tell the House how many vaccines have been delivered by the UK government for use in Scotland?
Well, we distribute the vaccine supplies that are available according to population, so based on the Barnett formula. And then in Scotland, of course, it's the Scottish NHS that is delivering. So a fair population share of vaccine is available to the Scottish NHS, and that's available right now. They have the stocks to be able to do that. And then, of course, it's for the NHS in Scotland to do the vital work of making sure that each and every one of those jabs gets into somebody's arm and helps to protect lives.
Let's head up to Yorkshire with Julian Sturdy. Julian Sturdy.
Thank you, Mr. Speaker. The vaccination programme in York is making encouraging progress, with the first doses of the Oxford vaccine arriving last week, and Askham and Haxby centres delivering injections in line with the priority list, which is fantastic news. However, can the Secretary of State reassure me that every care is being taken to ensure that smaller GP practices in rural areas are in no way disadvantaged in scheduling their patients for vaccination relative to the more larger urban practices?
Of course, it's small or large, rural or urban, we need people we need GPs to be vaccinating right across the country, and that's what's happening. We're organising this through what are called primary care networks, which are groups of GPs that cover between 30,000 and 50,000 patients. And the reason to do that is so that each of a group of GP practices can contribute some staff to the vaccination team so that they can carry on with the other vital work that they're doing. So these networks are, of course, larger in more sparsely populated parts of the country like North Yorkshire, but nevertheless, that's why we've put in place this commitment to everybody having a vaccination centre within 10 miles of where they live to make sure that we do reach all parts.
Stephen Morgan.
Thank you, Mr. Speaker. There is welcome news that St James's Hospital in my constituency is to become a vaccination centre, and constituents are eager to see it up and running. Will the Secretary of State confirm when the hard-working staff and volunteers on the ground will receive the doses and equipment they need to open the centre?
Yes, I'm really delighted to hear to highlight that news, and I'm also really glad, Mr. Speaker, that as the honourable gentleman has just demonstrated, this is a national effort that we can all play our part in, and it's the support across party that we've received for the vaccination effort and that the NHS has received is incredibly welcome, and I know that the NHS team on the ground will really appreciate the honourable gentleman's support. The kit will be delivered on time. Over 98% of vaccines have been delivered on time. Of course, there's always, in a very large logistical exercise, the occasional hiccup, but I'll get back to him and I'll make sure that the Minister for Vaccine Deployment gets back to him with the precise details of when the kit will arrive at his local hospital.
Thank you, Mr. Speaker. It's fantastic news that 2.3 million people have already received the first dose of this vaccine across the whole of the UK. Now, businesses and venues across Milton Keynes are queuing up to offer their support for the vaccination programme, including the wonderful ECG training, where I went for a COVID test last week. I passed, by the way, Mr. Speaker. Can the Secretary of State tell us what the plan is for accepting these kind offers of help and support with the vaccination programme?
Well, I'm really delighted that ECG training are involved in hosting some of the testing centres. And of course, we've had amazing offers of support that are now being used as testing centres and as the over 1,000 vaccination centres that we have across the country. We've been working with some sites since the summer to be ready to be vaccination centres, and we're always open to further offers of support. But I would say that we have been working on this for some time. It's also important, of course, that for infection control reasons, when we have testing centres and vaccine sites, if they are put in the same place, then they're kept separate, not least because of, we want to make sure that when an octogenarian goes for a vaccine, then they are, of course, kept safe in the process of getting the vaccine. The thing to do is to raise this specific offer of support with my honourable friend, the Minister for Vaccine Deployment.
Let's head to Scunthorpe with Holly Mumbycroft. Holly Mumbycroft.
Thank you, Mr. Speaker. Can I thank my right honourable friend for his help in getting the vaccine into our Ironstone Centre, Scunthorpe Hospital, and I'm really pleased to say some of our care homes too now. Can he tell us how the new Oxford vaccine will speed up access to the jab for those still waiting, and what that means for towns and villages in my area, such as Hibblestow, Scorby, Kirton Lindsey and Messingham? Will they see more local vaccination centres? Thank you.
Thank you very much. It is so important to get the vaccine to care homes, and over a quarter of care home residents have now received their first dose of the vaccine, and the Oxford AstraZeneca vaccine is, of course, much easier to get to care homes. We'll be doing that by taking the vaccine to the care home rather than opening new centres. But I want people in Hibblestow and Scorby and Kirton Lindsey and Messingham and throughout the Scunthorpe constituency to know that they will be within 10 miles of a vaccination centre, because we know how important it is that everybody can access this vaccine.
Let's head to Brigangul with Andrew Percy. Andrew Percy.
Thank you, Mr. Speaker. Can I also thank the 5 GP vaccination centres serving my constituency in Brigangul, Euston Ferry, Scunthorpe and Barton. They're doing a cracking job at getting this vaccine out. As we move from phase 1 into phase 2, though, and the JCVI advise that we'll be able to start looking at particular occupations, can I ask the Secretary of State to bear shop workers in mind who have had to work throughout this pandemic, including at the beginning, without any protection and who deal with hundreds of people every day? Can we make sure that they are prioritised as we move from phase 1 into phase 2?
Yes, I want to thank shop workers in essential shops who've got to be there for all of us. So even in these difficult times when the virus is widely spread, and we'll be looking very carefully at those professions that will need to be prioritised in phase 2 of the prioritisation programme. We'll look at, of course, teachers and police and others, but also we will look at shop workers, and we'll make those decisions based on the data.
Robbie Moore.
Thank you, Mr. Speaker. Can I commend the work that my honourable friend is doing in terms of the vaccine rollout? Across West Yorkshire, we have 4 large-scale vaccination centres planned, but this means in the Bradford district that we've got 1. Can I put in a plea to have a large-scale vaccination centre in Keighley, but also consider where smaller scale offerings are coming forward, like Ilkley Rugby Club, that they could also be considered as vaccination centres?
We'll absolutely look at those 2 suggestions, but I would just also remind my honourable friend and all of his constituents and all those across the Bradford district that yes, there are the large-scale vaccination centres, but there's also the primary care-based delivery, which is happening right across the country.
Let's head to Twickenham with Munira Wilson. Munira Wilson.
Thank you very much, Mr. Speaker. It's been reported that Pinnacle, the IT system being used to organise the vaccinations, is already struggling to cope with heavy usage. My local GP vaccination hub, which I visited on Friday, reported it was being slow, and there have also been worrying reports about very elderly people having to queue for a long time outdoors while staff try to get the IT system working. Could the Secretary of State confirm then, please, what action the department's taking to ensure that the systems work more efficiently and will be able to cope as the number of vaccination sites grow?
Clearly, the IT underpinnings of this project are critical. The Pinnacle system is working well, but we're constantly monitoring it to make sure that it supports the rollout of the vaccine.
Shadow Secretary of State Ashworth.
Sorry. Thank you. Thank you, Mr. Speaker. Of course, our encouragement at the rollout of the vaccine is, of course, our sense of encouragement is, of course, tempered by our deep alarm at the situation we are in. Over 80,000 people have died. On current trends, we are likely to see more deaths in this wave than we saw in the first wave. Millions still have to go to work, and this virus is now more infectious. Those still going to work are, of course, NHS staff. The BMA say 46,000 of them are off sick with COVID. Can he go further and faster and ensure that NHS staff, frontline staff, receive the vaccination in the next 2 weeks? And can he provide daily updates on the numbers of NHS staff who have been vaccinated?
Well, we do now provide the daily statistics on the rollout of the vaccine, and we'll provide more data as the system matures and as the rollout advances. He's absolutely right, Mr. Speaker, to raise the challenges that the NHS is facing today, and it's very important that whilst the rollout of the vaccine is proceeding well, and we're on track to hit the targets that we have set, we must also stress to everybody the importance of following the rules which are in place in order to control this virus and reduce the pressures on the NHS, which are very considerable at this moment.
We all understand that until vaccination is rolled out more generally, we will continue to see hospitalisations. And the NHS is currently in a crisis. Beds are filling up. ICU surge capacity is being maxed out. Ambulances are backed up outside hospitals. And there are warnings about oxygen supplies as well. I mean, hospitals were not built for these demands on oxygen. So can he assure us that there are contingencies in place, and can he guarantee that no hospital will run out of oxygen in the coming weeks?
Well, Mr. Speaker, there are these very significant pressures on the NHS. When it comes to the specific question about oxygen supplies, the limitation is not the supply of oxygen itself. It is the ability to get the oxygen through systems, through the physical oxygen supply systems within hospitals. And that essentially becomes a constraint on an individual hospital's ability to take more COVID patients, because obviously the supply of oxygen is central to the treatment of people with COVID in hospital. And because we have a national health service, If a hospital can't put more pressure on its oxygen system, then people go to a different hospital and we take people to a different hospital. So I can assure him that there is no constraint that we are anywhere near on the national availability of oxygenated beds. It does mean, as he knows and as we've seen reported, that sometimes we have to move patients to a different part of the, as local as possible, but occasionally across the country to make sure that they get the treatment that they need.
Let's head up to Scotland with SNP spokesperson Dr Philippa Whitford. Dr Whitford.
Thank you very much, Mr Speaker. Yesterday, the Secretary of State revealed that only a quarter of care home residents in England have been vaccinated against COVID, despite being the #1 priority group. Can he explain why they were not the first cohort to receive the Pfizer vaccine in December, as was the case in Scotland?
That's not quite right, Mr Speaker. I'm glad to report that care home residents have been receiving the Pfizer jab. It is harder and logistically more difficult, and I'm delighted that if you look at the total rollout of the programme, as she says, over a quarter of people now who are residents in care homes are able to get the jab, and that number is rising sharply.
Turning to Dr Whitford. Dr Whitford. Dr Whitford's second question has disappeared. We'll move on. Navandu Mishra, have we got a substantive question? Who's answering? Minister.
Thank you very much, Mr Speaker. I'm sure, firstly, that the whole House will want to join me in sending our best wishes to the Right Honourable Member for Old Bexley and Sidcup and his family for his treatment, and we look forward to seeing him back in this place in due course. The NHS has been clear since the beginning of the pandemic that the continuation of urgent cancer treatment must be a priority. Latest data showed urgent cancer referrals continuing to increase, with nearly 88% of all patients seeing a specialist within 2 weeks of referral and nearly 96% of patients receiving treatment within 31 days for a decision to treat. However, I must caveat that the context for this data was before the recent rise in coronavirus cases. The NHS is open. It is hugely important that any person worried about any symptom comes forward and knows that care is there.
Mishra.
Speaker, I'd like to associate myself with the comments regarding the honourable member for Old Bexley, and I wish him a speedy recovery. I also want to thank the hard-working colleagues in the NHS that are doing everything they can to ensure that cancer care and treatment can continue. However, unfortunately, due to the unprecedented demand on ICU capacity caused by the pandemic, an increasing number of urgent priority 2 cancer surgeries have been cancelled. Can the Minister assure me that everything is being done to work with the Treasury to increase capacity available to the NHS by continuing to commission the independent sector to ensure that urgent care and treatment can continue so that cancer doesn't become the forgotten sea in this crisis? Minister.
Thank you very much, Mr Speaker. I can unreservedly say yes to that. I would like to also say that what has happened, the NHS is under huge pressure, and there have been some instances where unavoidable, for totally understandable, unavoidable reasons, such as staff ICU capacity or the safety of patients themselves, treatment has been rescheduled. Any such decisions are always made as a last resort, but we have changed the way we operate, making sure that we've got COVID-secure cancer hubs, consolidated surgery, centralised triage to prioritise those patients whose need is most urgent. And we have utilised the independent sector and will continue to do so to increase capacity. These measures and the tremendous efforts, as the Honourable Member said, of our NHS cancer workforce and their teams is helping ensure that those who need treatment can continue without delay.
Minister Alex Norris.
Thank you, Mr Speaker. Throughout the pandemic, we've been calling for a cancer recovery plan, so we were glad to see one published in December, but disappointed that it only ran for a couple of months. Events have clearly overtaken us since that publication, and the unprecedented demand on our NHS risk further delays to treatment and to people entering the system for treatment. These plans must now go much, much further. Will the Minister make a commitment today to work with the sector and interested parliamentarians to develop the recovery plan into one that properly addresses the backlog and builds improved treatment pathways for the future?
Thank you, Mr. Speaker. I'd like to thank the honourable gentleman. We worked on the Cancer Services Recovery Plan, was worked on by both clinicians, stakeholders, including the charities, to make sure that we had a robust plan for addressing the challenges that have come about throughout the pandemic. The levels remain high into referral and treatment despite other pressures on the NHS, but I would like to assure him I meet regularly with both Callie Palmer and with Professor Peter Johnson, who lead for the NHS in this area, and we have made it absolutely clear that since the beginning of the pandemic, the continuation of urgent cancer treatment is a priority, as is the restoration, and then making sure that we can do what we can to ensure that swift treatment is there for everybody. And I meet regularly with APPGs. Indeed, I'm meeting with one Thursday of this week, so I can assure him on that front.
Going back to Scotland, to Dr Whitford, with the Secretary of State to answer the second question. Dr Whitford.
Thank you very much, Mr. Speaker. As the Secretary of State highlighted earlier, primary care networks will play a major role in rolling out the vaccine in England. But we've heard previously from MPs that not all areas are covered by such networks. So how does he plan to avoid a postcode lottery and ensure equitable access, and particularly outreach into vulnerable ethnic or deprived communities?
Mr. Speaker, 99% of GP surgeries are members of primary care networks. The very, very small minority that aren't are being dealt with to ensure that we have the fair access to vaccines, as she says, and of course they'll be covered by invitations to the large vaccination sites as well. In addition, in the second part of the question, I agree very strongly with her that it's vital that we reach into and support those communities who may be more distant and harder to reach, both geographically and in some cases culturally. The NHS is very well placed to do that and is one of the most trusted public services in support of encouraging all those from all backgrounds to take the jab, and pharmacists too will play a vital role in this outreach programme.
Substantive question to Minister number 60.
Thank you, Mr. Speaker. Community asymptomatic testing. With your permission, Mr. Speaker, please may I group questions 16, 17 and 18. Community asymptomatic testing is an important tool in the fight against COVID-19. We've delivered over 5 million lateral flow tests to the 117 local authorities that have already gone live with testing their communities, and we are rapidly expanding the programme to all remaining local authorities in England, as well as working with devolved administrations on their plans.
Let's head up to Rother Valley with Alexander Stafford.
Thank you, Mr. Speaker. 94-year-old Tom Drury-Smith from Todwick was the first to receive the vaccine in Rother Valley at the Anson Medical Centre, thanks to the amazing work of the Rotherham CCG and the Primary Care Network. Will my right honourable friend agree with me the key to both community testing and the vaccine uptake is to ensure people do not have to travel far to access centres, especially those who are older who do not have access to cars? And can she assure me and others that the vaccine centres and community testing centres will be sited as appropriately as possible, including Rother Valley areas such as Swallownest and Maltby?
I thank my honourable friend for the question, and it's absolutely great to hear about the work of Rotherham CCG and my honourable friend's Primary Care Network, who are clearly on the front foot in this vital work of vaccinating people at high risk in his community. And absolutely, and as you may have heard from the Secretary of State earlier, we are making sure that everybody is able to access community testing as they need it, but also a vaccination centre within reach.
Let's head to Derbyshire with Heather Wheeler. Heather Wheeler.
Thank you, Mr. Speaker. Would the Minister join me in welcoming the opening of community testing centres around Swadlincote in recent weeks, paving the way for greater testing capability and coverage right the way across Derbyshire. Could the Minister also confirm that the rapid lateral flow tests being used are indeed accurate and reliable and are an important tool in tackling asymptomatic transmission of the COVID virus?
Well, I'll absolutely join my honourable friend in welcoming the opening of community testing centres in Swadlincote. Asymptomatic testing enables us to pick up cases in high prevalence areas that otherwise would go undetected. So this means we can break chains of transmission. There's been extensive clinical evaluation from Public Health England and Oxford University that shows that lateral flow tests are appropriate for this use. They identify over 2/3 of all people who have COVID-19 but often don't have symptoms, and importantly they catch the vast majority with a high viral load.
Let's head to Lincoln with Cole McCartney. Cole McCartney.
Good morning, Speaker, and thank you. What specifically can be done to assist school teachers in Lincoln and across the country to have readily available rapid lateral flow antigen tests to enable them to carry on teaching and for schools to stay open and maybe for exams to be sat?
Thank you, Mr. Speaker. I can assure my honourable friend that most secondary schools and colleges have already set up testing sites and have begun weekly testing using lateral flow devices for staff who are currently in school. Staff can also participate in daily contact testing on site, and primary schools will shortly be receiving test kits for weekly staff testing and also daily contact testing.
Shadow Minister Justin Madison.
Thank you, Mr. Speaker. We can have all the testing in the world, but it won't be effective if people don't self-isolate after a positive result. We have repeatedly said compliance with self-isolation rules is not good enough, and we've only 1 in 8 people qualifying for the self-isolation payment. That is not surprising. So can the Minister ensure that everyone is properly supported to self-isolate from now on? And can she also explain why those who test positive after a lateral flow test cannot apply for a payment and do not even enter the National Test and Trace system?
Well, absolutely. We recognise not only the importance of self-isolation, which is critical in breaking the chains of transmission, but also that it is not always easy for people to do so. We recognise, for instance, the cost of self-isolation. That's why we introduced a payment of £500 for those who are on low incomes and unable to work from home while isolating. We will continue to make sure that people have the support that they need to self-isolate.
Substantive question to Secretary Hancock.
Thank you very much, Mr. Speaker. The Innova lateral flow tests for COVID-19 identify a substantial proportion of those who are shedding viral load due to their COVID-19. We, of course, identify, analyse and publish the evidential basis for the use of these tests, as with the other tests that are used in the National Testing Programme.
Heading up to Scotland with Neil Hanby. Neil Hanby.
Thank you, Mr. Speaker, and I would like to thank the Secretary of State for that answer. I would also like to thank him for his helpful response to my questions in the Select Committee last week. And in that spirit, he will know that I've been pursuing the use of lateral flow tests since early November when concerns were first raised. Unfortunately, some of those concerns continue to persist, and not least they were underscored by communication from his department as recently as the 11th of December, which stated, "We are not currently planning mass asymptomatic testing. Swab testing people with no symptoms is not an accurate way of screening the general population, as there is a risk of giving false reassurance. Widespread asymptomatic testing could undermine the value of testing, as there are a risk of giving misleading results." Given those ongoing concerns, I would be most grateful if the Secretary of State would commit to a meeting to consider those concerns in a bit more detail.
Order. I think the Secretary of State can take an answer off that.
Lateral flow tests are incredibly important to be able to find people who otherwise we wouldn't be able to find. 1 in 3 people, Mr. Speaker, have this disease without knowing it, and finding those positive cases helps us to break the chains of transmission.
Let's head up to Yorkshire with Clive Bett. Clive Bett. Oh, substantive question first, Minister.
Thank you, Mr. Speaker. I'm pleased to report that the strong recent performance of the contact tracing service has been maintained even with a significant growth in cases. The latest weekly data show the service made contact with almost 700,000 people. 85% of positive cases were reached and provided details of their close contacts, and 92% of those close contacts, that's almost 500,000 people, were then reached and told to self-isolate.
To Sheffield with Clive Betts. Clive Betts.
Speaker, I was asking the Director of Public Health in Sheffield the other day about the figures for contact tracing. He says that in the NHS test and trace system, not the Public Health England one, the NHS one, the current figures are 59%. Then of the 40% not contacted, they're passed on down to the local level, to the City Council's contact tracing service, which is then contacting 75% of the people the national system couldn't contact. Why then doesn't the government give more resources and more responsibility to the local council, to the Director of Public Health? In that way, we could contact more people at far less cost than the national system.
Thank you, Mr. Speaker. Well, the Honourable Member has described, in fact, what is a really important partnership working between the national NHS test and trace system and local partnership with local authorities, as indeed is happening in his own area of Sheffield, where it's that combined working which enables us to contact the maximum number of people and therefore get more people to self-isolate and break these chains of transmission.
Mitchell.
Thank you very much, Mr. Speaker.
Question 27.
22. Care at the end of life is a crucial part of our health and care system, and we're committed to improving the quality of care for those at the end of life. Current practice is informed by a range of evidence, including guidelines issued by the National Institute of Clinical Excellence. The government is open to gathering data on terminally ill people's experience in order to inform the debate.
Andrew Mitchell.
Thank you, Mr. Speaker, and may I also express my gratitude to the NHS in all its many forms in the royal town of Sutton Coldfield for all their hard work over Christmas and the New Year, including giving me a new knee. Mr. Speaker, can I thank the Secretary of State for managing to take an interest in this important subject when he is so stretched on so many other fronts? Can I say to him that nearly 10% of suicides are by people who are terminally ill? And the APPG, which I have the privilege of co-chairing, will hear from a mother this afternoon whose terminally ill son took his own life by throwing himself under an HGV on the North Circular. To add to knowledge, information and understanding, will he and his department make a point of working with coroners and the Office of National Statistics from across the country so that we can understand the true extent of these tragedies?
Yes, of course. I'm very happy to look at the suggestion that the Right Honourable Friend, my Right Honourable Friend, makes on this very sensitive subject. We want to see the highest possible standards of patient safety and, of course, reduce the number of suicides. And it is important in pursuing that to have as much information and evidence as possible.
We have a substantive question to Minister Zahawi.
Thank you, Mr. Speaker. Across the United Kingdom, Mr. Speaker, we have over 2,700 vaccination sites up and running, with 7 vaccination centres opening this week and more to come next week and the week after. Regarding Fielding Palmer Hospital that my honourable friend has raised, I can confirm, Mr. Speaker, that this site is now being actively considered as a vaccination hub.
Let's head to South Leicestershire with Alberta Costa. Alberta.
Thank you, Mr. Speaker. Can I thank the Minister and his team for the help that they gave me and my team in cajoling, pushing, encouraging the CCG to reopen the Fielding Palmer Hospital in Lutterworth as a vaccination centre. This is excellent news for the people of Lutterworth and the surrounding villages. Will the Minister also confirm that the remaining parts of South Leicestershire, from Broughton Astley to Braunston, from Thorpe Astley to Arnsby, will also be able to access vaccination centres locally?
Thank you very much, Mr. Speaker. I'm grateful to my honourable friend, not just for his support, his characteristic support and encouragement, but also for his championing of his constituents. I can confirm, as the Secretary of State has said, that all his constituents will be no more than 10 miles away from a vaccination centre. And I'm pleased that the Sturdy Road Health and Wellbeing Centre, which is a little over 10 miles away from Lutterworth, are administering vaccines now.
We now have a substantive question from Bob Seeley to Minister Hancock.
Thank you, Mr. Speaker.
Mr. Speaker, the government's response to the pandemic has been informed by a considerable range of expert scientific and medical advice, and we've seen an increasing understanding of coronavirus globally. The UK has produced new scientific evidence throughout the pandemic, and when we take decisions, these are based on and guided by the best possible science, but of course policy decisions are for ministers.
Let's head to the Isle of Wight with Bob Seeley. Bob Seeley.
Thank you, Mr. Speaker. I thank the Secretary of State. Regarding the stats and science on the island, our vaccine hub at the Riverside Centre is expected to be ready on the 15th of July. We may not receive sign-off on vaccines for that centre until the 25th of July or later. With our rise in infection on the island, our demographic profile and our isolation, I'm concerned we're not high enough on the vaccine supply list, despite the great work being done by the Isle of Wight Hampshire team. I've written to the Secretary of State and the Vaccine Minister about this. What can be done to improve the situation, and what reassurance can you give to me and folks on the Isle of Wight? Thank you.
Mr. Speaker, we will absolutely have vaccines being delivered on the Isle of Wight before the 15th of July. Indeed, we'll have them there before the 15th of February, and we're committed to offering a vaccine to all those in the 4 highest priority cohorts, which includes all over 70s, and there's a lot of over 70s on the Isle of Wight. Furthermore, we will make sure that we have vaccination centres within 10 miles of where everyone lives. There are vaccinations happening on the Isle of Wight right now. My honourable friend is a great champion of the island, and we'll make sure that that delivery continues apace.
Substantive question to Minister Zahawi.
Thank you very much, Mr. Speaker. The vaccines are, without a doubt, the biggest breakthrough since the pandemic began, a huge step forward in our fight against coronavirus, and testament to the Secretary of State's absolute laser-like focus on vaccines. We are here today with 2.4 million doses administered and rising. However, Mr. Speaker, the full impact of COVID-19 vaccinations on infection rates will not be clear until a larger number of people have been vaccinated.
Let's head to Wickham with Steve Baker. Steve Baker.
Mr. Speaker, I'm very pleased to welcome the announcement of a vaccination site at Adams Park in Wickham and further sites to be announced shortly. My honourable friend has told us that when the top 4 JVCI groups have been vaccinated, that will account for 88% of fatalities. So can he not very soon give people a hope which is sure and not too distant that their freedoms will be returned as this vaccination programme rolls forward?
Thank you very much, Mr. Speaker. I'm very grateful for my honourable friend's continued support, and not least on making sure that he examines the data very carefully. I know something that he's passionate about. He's absolutely right that when we offer the vaccine to those top 4 most vulnerable cohorts in the list of 9 from JCVI, 88% of mortality effectively comes from those 4 cohorts, 99% of mortality from the top 9 most vulnerable cohorts. At a point in time, that point of inflection between community spread and, of course, vaccination, and as I will quote the Deputy Chief Medical Officer, Jonathan Van Tam, when he said, ask me in a few weeks, few months' time if it does obviously impact on spread. The scientists are hopeful, as are we, as is the Prime Minister, not least because he wants to see the back of these non-pharmaceutical interventions in the economy.
A substantive question to Minister Aga.
Thank you very much, Mr. Speaker. And with your permission, sir, I'll group questions 27 and 28. COVID, and particularly the new strain of COVID, has had a significant impact on NHS bed capacity. As of the 10th of January, 30,758 beds across the NHS were occupied by COVID patients. Just in the past day, that has risen to now around 32,000. That's around over a third of all available beds. The latest bed occupancy data shows just shy of 80,000 out of the NHS's roughly 90,000 total general and acute beds were occupied.
Let's head up to Acton with Dr. Hart. Dr. Upahar.
It's great that the NHS, as I've heard locally, are working hard to stop intensive care beds running out after a decade of no expansion, now that London's been declared a major incident. But can he guarantee that rather than just a bureaucratic exercise, taking a population-based approach, listening to clinicians in apportioning capacity and allowing high-need mixed ethnicity areas their fair share, like Ealing Hospital, currently on a black alert, rather than just always the powerful players of central London teaching hospitals getting all the extra allocation?
Thank you, Mr. Speaker. I'm grateful to the Honourable Lady. I can reassure her that beds and increased capacity, where we put that in place, is allocated on the basis of where it is needed. And just briefly, in respect of her local hospital trust, London North-West University Healthcare NHS Trust, she's right to highlight the pressure they are under. The team there, as across the NHS, are doing an amazing job. But at her trust, the critical care bed occupancy rate was 98.7%. on the latest figures I've had. That is extremely significant in terms of pressure, but I can give her the reassurance that we look to ensure all areas receive the resources they need.
Let's head up to Lewisham with Ellie Reeves. Ellie Reeves.
Thank you, Mr. Speaker. London has declared a state of emergency, and the stark reality is that at this rate, we'll run out of beds for patients within the next couple of weeks. At least 2 NHS hospitals in the capital have already postponed urgent cancer surgery, and figures show that treatment levels are failing to keep pace with demand. Will the Minister therefore commit to fully opening the London Nightingale Hospital, secure the use of London's private hospitals for cancer treatment, and invest in the number of beds in our NHS for the long term?
Thank you, Mr. Speaker. And the Honourable Lady is absolutely right to highlight the pressure that the NHS and critical care is under in London, but indeed more broadly than that. And I pay tribute to all those, again, who are working in that. Indeed, my shadow, who I suspect has been on the front line in recent days as well, and I pay tribute to her, Mr. Speaker. The best way we can thank them is by following the advice to stay at home and to follow the rules. In respect of her specific point, yes, we are involving the independent sector capacity, Nightingale capacity, and increasing NHS capacity, all of those alongside other measures to ensure that our NHS continues to be able to treat those who need this care at this time.
Shadow Minister Dr. Hassan Alan-Khan.
Thank you, Mr. Speaker. Last night, I finished a shift in a busy East London hospital, sharing difficult news with hopeful families. The resilience of staff on the front line is one that can never be matched, but across the country, morale is on a cliff edge. A decade of cuts to beds, services and staff, combined with pay freezes, have left NHS workers undermined and undervalued. Without our incredible staff, a hospital bed is simply just that, a bed. So does the Health Minister regret how the government have made frontline workers feel? And can he promise to change this?
Thank you very much, Mr. Speaker. Well, I would reiterate, as I did earlier, my thanks to her and indeed all of her colleagues in the NHS for everything they're doing. And I would reassure her, as I do and as my right honourable friend does at every opportunity, just how valued and supported our NHS are. We have put in place, I think, just over 1,000 additional critical care bed capacity at this time. Right thing to do. And in addition, in respect of supporting staff, we are investing around £15 million, just one example, £15 million in support around mental health hubs and mental health support for staff who I saw from the hospital she works in her constituency, or has worked in. A number of staff on the BBC recently setting out just how flat out they are. The best way we can thank them alongside what we're doing, as I say, and I make no apologies for reiterating it, Mr. Speaker, is that we all need to follow the rules, to stay at home, to help ease the pressure on those phenomenally hard-working and valued staff in our NHS hospitals.
We now come to topical questions to the Secretary of State for Health and Social Care. I call Secretary Matt Hancock to make a statement on his responsibilities. Then I will call Rachel Maskell to ask her supplementary.
Thank you very much, Mr. Speaker. Mr. Speaker, yesterday we launched our UK vaccines delivery plan, which sets out how we'll vaccinate hundreds of thousands of people every day, starting with the most vulnerable and staff in NHS and social care. I'm delighted that across the UK, 2.3 million people have already been vaccinated, and we're on track to deliver our commitment to offer a first dose to everyone in the most vulnerable groups by the 15th of February. At the same time, Mr. Speaker, may I add my voice to all those who are passing on their very best wishes to my right honourable friend, the member for Bexley and North Sidcup, who is undergoing further treatment on the NHS, and thank personally all of those in the NHS who are looking after him and all of the other patients who are in their care.
Let's head up to York with Rachel Maskell. Rachel Maskell.
Thank you, Mr. Speaker. The NHS is overwhelmed and critical clinical choices are having to be made due to the limitations of estate and of staffing. So I asked the Secretary of State if he will do two things. One, bring all independent hospitals under the NHS to provide response to the national crisis and in particular provide cancer care capacity. And secondly, call all former health professionals to return to practice and re-register, even if they are beyond the 3 years out of practice limit, so they can work with an element of supervision so no one is denied the clinical need that they have.
Well, Mr. Speaker, of course all these things are being looked at, and the pressures on the NHS are very significant. I'd also want to say, though, to people who have a healthcare condition that is not COVID related, that they should come forward to the NHS, because that promise that the NHS has of always treating people according to their clinical need, not ability to pay, that promise is crucial, and it's just as crucial in these pressured times as it is at any other time. So if you find a lump or a bump, if you have a problem with your heart, if there is a condition that you need to come forward for urgent treatment for, then the NHS is open and you must help us to help you. So yes, we absolutely will do everything we possibly can to address the pressures, including the measures, looking at the measures that the Honourable Lady set out.